be going over lumbar traction. It's one of the features of our office called Flexion distraction. So I have a patient here. I'll go ahead and strap her feet into place here. Her hips are going to be about halfway up the table. And this is a therapy that we use for people with lower back pain. So my goal on setup is to have the patient's hips right about where the table is going to bend. And so what's going to happen as we set it up is the table is going to bend her lower body towards the floor. Upper body will stay the same, and what's going to happen is creating a gap essentially in the lower back here. So a decompressive therapy for people with disc issues in the lumbar spine, anyone who has overextension issues, so gymnasts, wrestlers, repetitive exercise. A lot of people do triathlons and things like that. Anyone with like an overextension injury of the lower back, facet syndrome, things like that. This is just opening that space up, decompressing the spine, reduces muscle tension along the lower back, and in general just feels great for the patient. So it's one of the things we use to help just relax the lower back, especially when they come in with acute pain. Helps just kind of get over that hurdle of being able to tolerate treatment. So we'll do this for a few minutes. At the end we'll begin some massage work. But again, the patient can control with their hands how much or how little bit of a stretch they're getting based on their tolerance level. And for those patients who have maybe trouble getting a good enough stretch, that's where I come in. You can add just a little bit of assisted traction here, or if they have a particular level where they have a disc herniation or bulge, we can target that specific level and just get a bit more of a traction and stretch there. Alright, so now I'm going to show you one of the massage devices we have. It's called a deep muscle stimulator. The purpose of this, it's a strong massager with a lot of vibration. The purpose is to help relax the muscles anywhere along the spine or body. So in the instance of this patient, we're working on the lower back. So we have two large sets of muscles across the lower back, just on either side of the spine. I'm going to turn the massage device on. I always tell people if it's too strong to let me know. So we'll start here, staying off the bone. Just going to slowly work our way into it. And so I'll be able to feel as I move along where maybe there's a bit of a trigger point or tight muscle. And we just work on that. So the feeling of this can range anywhere from strong to ticklish to amazing, depending on the patient and how sensitive they are. Extremely effective though at loosening up the muscles and making the adjustments go better. Switch sides to the other side of the spine here. And our patient who's got neck and upper back pain, maybe some shoulder issues, we work right along the traps and the rhomboids here around the neck and shoulders. And again, depending on tolerance, we may push a bit harder or let up just a bit. Sides. Just a great way to decrease discomfort before the adjustment, relax the muscles. It makes treatment go a lot better. All right, thank you.